Now on your hips, and I would palpate that way. Go over your head again. If this was a woman, I'd be really concerned and careful examining the upper outer quadrants. But again, he's a boy. I'm gonna palpate his lymph nodes. Okay, go ahead and relax. Relax. And I'm just relax, and I'm gonna hold your arm. Don't use any muscle. So I've got axillary. Any tenderness? Nothing. And then central. Anything? Lateral. Pectoral. In the back, do subscapular. Any tenderness? Nothing? You feel good? And then right here, epitrocular. Any nose? I don't feel anything. And I would do it on the other side. I would do the same thing. And let me see under here. You can see there's no hair, and that would be an expected finding. But when he's older and going through puberty, I would expect hair to be growing there. So now I'm going to do a cardiovascular assessment, and for this assessment, I have a cardiac stethoscope that has volume enhancement, so I don't have a bell, but it is a cardiac stethoscope. So for my cardiovascular assessment, I'm starting with his pulses. I'm going to check for radial pulse. It's wonderful pulse. +2. Brachial. +2. I'm going to look for jugular vein distension. Can you turn to the other side? There's nothing there. Can I lift up your shirt? So now I'm going to just view his chest. I'm looking for any kind of heaves and abnormalities. So your heart's right here, and you're going to palpate aortic, pulmonic, Erb's point, tricuspid. Ooh, you can feel it. Tricuspid and mitral. The mitral's right at the 5th intercostal space, and I can feel it. It feels good. And there's nothing. I can see actually the mitral, the point of the heart right here, and I can see it beating. So now I'm going to listen to it. I'm going to listen to your heart. I didn't need to call you it. Listen to it, your heart. Okay, ready? Pulmonic. Erb's point. Tricuspid. Mitral. You don't have to breathe like that. Okay. Can you do me a favor? And can you sit up straight? Like sit up normally, and I'm going to do this. I'm going to listen to the same areas of your heart. So with the patient sitting up, I'm going to listen to the same areas again. Okay. Sit up. Yeah. Let me move this pillow for you. Yeah. Mitral. Pulmonic. Erb's point. Tricuspid. Mitral. Okay. Now I'm going to have the patient sit forward. I'm going to do the same areas of the heart, listening for any murmurs or any discrepancies in those sounds. Ready? So I want you, if you can, I want you to lean forward. and I'm going to listen to the same. So his rate and rhythm is normal. There is no abnormalities, no heaves or thrills, no murmurs. So his cardiovascular, his heart sounds good. So now I'm going to assess Andrew's abdomen. And he's voided already, so he's all set for this assessment. Can you tell me when the last time you went to the bathroom?
Like 1 minute ago.
When was the last time you went number 2?
1 minute ago.
1 minute ago? Okay. Can I look at your abdomen? So I'm going to look at his stomach and his abdomen area, and it is perfect. His skin is perfect. His muscles are all symmetrical. His belly button is perfect. He doesn't have any hernias. There's no protrusions. There's no masses. He's very muscular. He has a 6-pack. So that is perfect. Now I'm going to listen to your bowel sounds, because your belly makes sounds, and those sounds give me clues to how your GI tract is doing. So now I'm going to listen. I just like to start here at the beginning. So all the bowel sounds are positive ×4. They're not hyper or hypo. They're just perfect. Listen here. I'm listening for stenosis. And here at the iliac crest. It's good, nothing abnormal. Now I'm going to percuss his quadrants to listen for the sound. You relaxed? You hear that? You are. If he was full of, his GI tract was full, it would be dull. But his timpani, it's empty. So that's good. All right. So palpation, percuss. Now I'm gonna palpate his tummy and just feel for any masses or lumps. Tell me if I hurt you. Nothing? Oh, your belly feels so perfect. It's really perfect. You're so cute. Now I'm gonna check for femoral pulses and nodes. So I just right where your leg bends up, I just want to feel there for your femoral pulse, because you have a pulse there just like you have a radial pulse, and for nodes. So let me just feel that. And then let me feel for the pulse. Sorry, tickle you. It's a positive femoral pulse. Yep, and I'm just gonna feel for any nodes. Those are from the lymphatic system. Those clean you out. So that's what I'm feeling for. If you have nodes that you can feel, then that's a bad thing. Yeah, so negative for nodes. So that's good. He doesn't have any problems with that. Inspecting his lower extremities. I know that he is, he has his legs elevated at the moment, but I just know offhand that he doesn't have any dependent edema. As you can see, his skin is perfect with the exception of these just normal cuts and bruises that an 8-year-old would normally have from playing. And he has hair, and the hair is evenly distributed. All the way down to his toes. He's got good capillary refill, and again, he has no edema. Let me feel for your pulses. Popliteal pulse. Ooh, positive +2. Positive +2. Here, just I want you to relax. I don't feel this pulse. Let me try this one. Oh, it's bounding. Wow, it's perfect. It's +2. Ooh, and it's long. This pulse is actually longer. Usually I only feel it in like a half a centimeter, but this one feels like it's so long. It's like 2 centimeters long. And let me try the other side. I have a hard time getting this pulse always. I don't know. Oh, I have it on this side. So that's a +2. And then the dorsalis pedis pulse. Ah, this one's bounding too, +2. That means you have good circulation. Go down. I want to try this side again. I can't get it, but it's okay because I know that the furthest pulse point, which is this one, is a +2, and that he has good circulation in his lower extremities. And yeah, I can see that because his feet are perfect. He has good capillary refill. A little bit here on your toes. I'm gonna do some musculoskeletal assessments, starting with the feet. I'm gonna palpate. I'm gonna inspect and look at the feet. Everything looks normal. Looks normal. I'm gonna palpate your little toes. Oh, you have my favorite toes. I love your toes. And can you just wiggle your toes? Okay, since I'm down here, I'm gonna do the Babinski reflex. So I'm just gonna stroke this on the bottom of your foot, okay? I'm gonna see what happens. I don't know if you noticed that, but his toes went a little bit down when I stroked the bottom of his foot, which is a normal reflex. Had they went up, then that would be a sign of a neurological issue. Okay, and I'm just going to, can you just rotate your ankle, your foot? Yes. Yep, he has a full range of motion. And again. Yes, full range of motion. I'm going to palpate this here, your knees and your hips are good. Can you bring your knee up like this? Yes, yes. Can you do it to the other side? Okay, bring it back down. I want you to do some abduction. Can you bring this leg out and back in? Well, you're very flexible. And again on this side. Okay, that's perfect. Can you sit up? Yep, okay, good. All right, that's Andrew's ankle strength. So can you push onto my hand? Yes, with your ankle. Oh, strong. And now push down. Oh, you're so strong. And again. And again. Oh, perfect. And I wanted to do one last test. Oh, can you put this ankle to the shin? Can you lift it up stronger and do it? Like lift this up and put it over there. Put this like this. Go ahead, do it. Yep, and do it on the opposite side. Perfect. Okay. Now we're gonna test. We're gonna start with fingers, musculoskeletal. So let me look at your fingers. fingers look normal. They feel normal. They feel